Hello everyone, I'm Dr. Lori Langdon, board certified pediatrician, mother of 6, grandmother to 2, here with a quick update on breast milk donation. So you may know that we're currently in the middle of a crisis of infant formula shortage. So this has really brought to the forefront this idea of sharing or donating breast milk. So I would like to tell you guys, there is actually an Academy of Breastfeeding Medicine, and the American Academy of Pediatrics often refers to them for expertise in this area. So there's also a section on breastfeeding within the AAP, of which I am a member, and I can tell you within these last couple of weeks, I have been receiving multiple emails per day of everyone discussing this idea of the infant formula shortage and some of the solutions that could be provided through breast milk, even donor breast milk. So first of all, this is a great time to reiterate that the choice of breastfeeding is an excellent one. And we would certainly encourage all currently pregnant moms who are considering formula versus breastfeeding, if they are physically able and willing and interested, we would encourage you to do as much breastfeeding as possible. At least consider it to begin and give it your best effort. Obviously, our long-term goal is to make it to a year, but in the beginning, I just want you to think about day to day and what a benefit and bonus it is to your baby in so many ways. Also, this current shortage has brought around the idea, again, made popular again, this idea of relactation. So relactation is a thing. Not all moms can do it, but if they've been breastfeeding relatively recently and they suddenly increase demand on the breast tissue, usually by pumping frequently, they can often relactate. So that's an option for some moms. So let's talk about donor milk. This Academy of Breastfeeding Medicine made a policy statement in 2017 that outlined sort of a guideline for donor breast milk. The two main points are we want to medically screen the donor and we want to practice safe milk handling. So for medically screening the donor, that means we want the producer of the breast milk to be in good shape. We want the receiver of the breast milk to be a full-term healthy infant with no complications. We want this mom to pose no infection risks, and that can often be quickly assessed by looking at her prenatal labs that screen for multiple infections. We also want for her to be on no medications or herbal supplements that are contraindicated while breastfeeding. So one of the ways we use or look up this to see if it's compatible with breastfeeding or not is a textbook by Dr. Thomas Hale. That is called Medications and Mother's Milk. We use that a lot. That's the name of the book. And so we would make sure that this mom is physically healthy, no infections, that she's on no meds that contraindicate, and she's willing and able to do this donor milk without posing any threat at all to her own infant that may be also nursing at the same time. The other screening part for the donor mom is that she not have any unsafe social practices. In other words, we would obviously discourage the use of illicit drugs, nicotine products of any sort, any tobacco products, alcohol use, and any folks who are at high risk for acquiring HIV infection. So those are the things we would do for medical screening. The other thing we worry about is safe milk handling practices. So in the past, there have been cases of parents of infants who wanted breast milk, ordering it online, and then the breast milk arrives and it's in no condition to feed the infant. It's already spoiled, contaminated, thawed out if it was supposed to be frozen, and really not in good shape and not safe to use for the infant. So safe milk handling is very important. In this same policy statement in 2017 from the Academy of Breastfeeding Medicine, there's even an easy way to quickly pasteurize milk that's donated without compromising its nutritional content. So that's neat and worth a look if you're considering this. We would discourage anyone from getting random breast milk from just an internet connection from someone you don't know, who you can't screen, who you don't know what medicines they may be on or any risk factors they have. So I hope that helps clear up. We are certainly not opposed to donor breast milk. It just needs to be done in a wise and cautious way. We are also, by the way, relaxing just a tiny bit some of our usually very strict guidelines only because of the current crisis, and we'll return to our usual rules when the normal amount of formula is available. So typically we encourage babies to stay on only breast milk or formula for their milk source until their actual birthday, 12 months. But right now, if your baby is 11 and a half months and you wanted to stretch out your formula that you had remaining, and you did maybe 1 bottle of formula and the next bottle whole milk, or half and half formula and whole milk, that would be probably acceptable, as long as your baby doesn't have cow's milk protein allergy, obviously. So we are relaxing just a tiny bit. And remember, whole milk that we usually start at 12 months does not contain iron. So it's only okay to switch to that at a year, because we hope that your baby is now consuming plenty of iron-rich foods. So if that's not the case and you're nearing a year, start practicing introducing more and more table foods, and especially foods that are iron-rich, into their diet. So I hope this was helpful for you guys. Make sure you're screening the mother. Make sure you're practicing safe milk handling. Thanks.